So we have seen that health is influenced by a number of factors, and we have also seen that um, if people are not healthy, they are not going to be productive. So that means that it is very important that um, we invest in health, okay? Because of economic productivity, because of improving the quality of life, people living happily and fulfilling their life um, goals. Okay, so we can do that by investing in um, treatment of conditions. That is basically curative care services. So someone gets malaria, they are treated and they are well. That is curative interventions. And then preventive is when you don't want people to get the malaria in the first place. So that means that health systems or governments, organizations, and other players need to have uh, investments. They need to make investments in preventive and curative interventions. Okay. So the other point we are stressing here is that health is a good. We can actually say that health is a public good, and it generates what we are terming as positive externalities. That if people are actually healthy, generally, if people are healthy, you have other benefits that you get when you have people being healthy. And these benefits are that you have reduced transmission of diseases, you have increased the social capital, you have enhanced economic growth. Now, the word externality here it means that there are benefits. You have benefits that other people actually get because of uh, the population being generally healthy. You can have, for example, I'll use an example of if children are actually immunized, most of the children are immunized in a particular community. Even the children who are not immunized may benefit from the fact that you have many of the children actually being immunized already. So these few children who are not immunized are basically in a way protected, even if they're not immunized, because most of the people have been immunized. This is the concept to do with herd immunity. So herd immunity is an externality that you have, is a positive externality that you have people benefiting from an intervention which they have not been directly involved in. Okay, so that is what health does. If most people are healthy in a particular population, generally almost everyone basically benefits from that. That's why it is very important to invest in health. So how do we know that the health of a particular population is actually improving or is deteriorating? We use what you call measures of health to determine that. Okay, so the measures of health give us an impression of the general health status of the population that we are talking about. So we have health indicators, the things that will indicate that we are doing well or we are not doing well. So these health indicators are categorized differently. The most common indicator, one of the common indicators that we have is life expectancy. If you have a child born in South Sudan and you have a child born in Japan, how long will they live? Okay, we know that Japanese are some of the populations. There are some. they have actually have the longest or the highest life expectancy. Japanese have a high life expectancy. Okay, and we can generally say that they are more healthy because they live longer compared to us. And then we have morbidity. Morbidity is the number of it's about the number of people who are having um, certain diseases. Okay, that is morbidity. Being diseased. If you have a population of, let us say, 100 people, how many people are having these particular diseases? That is morbidity. And then mortality. Here we are talking about the number of deaths that are happening in a particular population. And then disability. Okay, someone who is having stroke may not be able to do certain things on their own, so that um, alters their quality of life. Okay, so that is a disability. They are alive, but they have a disability. Okay, so we can look at these indicators and know population A and population B, which population is having better health outcomes, okay, or is having